Hey guys, hope you're all blessed and well. First video of the new year. Hope everyone had a fantastic transition into 2019. Today we're going to be taking some time to talk about these healthcare sharing programs. And they're pretty popular now, and they're actually growing all the time. I'd say probably Medi-Share is the most prominent name in the industry that you've heard of, but there are many other programs like it, and there are others emerging. So I did some research on 4 of them. Medi-Share was one, then you've got Christian Healthcare Ministries, and then Liberty Health Share, and the 4th one was Samaritan's Ministries. So yeah, they are all faith-based, obviously, and in some cases, even your membership depends upon you verification that you attend a body of faith and a church, and you go to 3 to 4 Sundays out of the month. And of course, I think all of them, there is some kind of a statement of faith that you have to sign. So the whole objective here is that it's like-minded people that share the same values and faith system that are coming together and bearing the burden of each other's healthcare expenses. So it's a pretty cool concept, and these programs have hundreds of thousands of people, and then they've paid out billions of dollars in medical expenses, and in many cases they've been doing so for decades. So I'd say there's a pretty good track record of success going on there. So I want to just start off by saying, first and foremost, full disclosure, that this is not an endorsement in any way, shape, or form that you should belong to one of these programs. I just want to give you guys some information, kind of even high level, so that if this is something that you're considering for your family or for yourself, that you need to dig in and really learn for yourself if this is going to be appropriate for your family. I also want to say that these programs are not insurance in any way, shape, or form. And the biggest differentiator right there off the bat is that there's no contract involved. So nobody else is going to be contractually obligated to pay your healthcare bills, and you won't be required to do so for them either. These are voluntary programs of people that, like I said, are coming together to bear the burden of each other's expenses. So obviously, if you don't pay, though, they'll probably kick you out of the program. But the government's not going to come after you, because there actually is no government regulation on these programs. So that's pretty interesting. So some positives about these programs: there's actually no networks for the most part. One of them, in fact, being Medi-Share, does have its own PPO network. But the other 3 that I looked at, there is no network. So you can basically go anywhere you want to get your care. So that's a pretty cool thing. You have lots of flexibility there. Now, who is it for? I would say if you have care coverage through your employer and they're paying the majority of your bill, this isn't really something that you should be considering for the most part. This is going to be for people that are maybe self-employed, people that are maybe paying insurance out of pocket right now and are looking for some kind of a cost savings. I think there also will be a lot of people that don't have insurance that are going to be considering this, and that's because the individual mandate for the Affordable Care Act dropped off in 2019. So there's no longer a penalty to not have insurance like there was in 2018 and in years prior. So I think there'll be an influx of people coming in from that way as well. Cost savings is the biggest factor here. In some cases, I saw that the premiums, and by the way, they don't use the word premium because, again, they're not insurance companies, and they really even differentiate their lingo to not associate themselves with insurance companies. But for the sake of informational purposes, I will say premium today. We're about a third the price of a traditional insurance plan. And there wasn't even a annual deductible that had to be met. In this case, they had like a per incident deductible of $500. So I think that's pretty substantial. I mean, if you could cut your insurance bill down to a third of what you're currently paying, it would substantially change your financial circumstances. I'd say the other thing I want to say as far as benefit is that a great benefit, you don't have to pay for procedures or care that you don't agree with from a moral standpoint. Things like abortion aren't covered. Contraceptives, I believe, are not covered. even things like childbirth out of wedlock, I think were excluded from some of the plans. And I don't know how they verify that, but just something to know up front. So negatives or maybe cons to, belonging to one of the programs. Like I said before, there is no contract. Some people could see that as a negative. A lot of these are reimbursement models, so you actually will negotiate directly with your healthcare provider or wherever you get care, and negotiate the price down, and then you submit it in to be reimbursed. So some people may not like the fact that they have to do the negotiating. So if that's the case, there are some that have a third-party negotiation team that will do that for you, but you just really want to make sure you understand that going in and know which one you're picking. Claims could be denied if they ever ran out of money. So it's a pool, and I guess if the pool didn't have the resources in it to pay your claims, then technically you could be on the line for, a major whatever bill if you had some kind of a catastrophic thing happen or even a minor thing happen. With that being said, I don't think that that's happened in any of the 4 that I studied or looked into. So it seems like they're holding, a good amount of reserves, and they operate with a high level of efficiency. I think they probably have a lot less overhead than insurance companies. They're not for profit. So they're, operating with, I think, a good level of business ethics and making sure they've got their I's dotted and their T's crossed. There could be gaps in coverage. I'll also say that pre-existing conditions are typically not covered. So you'd have to be fully recovered before you, I think it's at least a year, and in some cases like 5 years if it's cancer or something of that nature, before you were able to join one of the programs. Things like medication are only typically covered for, I think, 6 months was the maximum that I saw. Some of the programs as little as 2 months. And it's specific for the type of care or incident that you had. So if you had like type 1 diabetes and you needed insulin on an ongoing basis, then this probably isn't going to be the right program, or this type of program isn't going to be appropriate for you. Like I said before, this is something that you're going to have to look into with your family. Do the research, learn about it for yourself. Their websites are pretty good. You can get quotes right there. And of course, call them if you wanted to learn a little bit more. I hear that customer service is really great at these organizations. So I'm going to put links below the videos so that you can get directly to their websites. Please comment if you have a question, and I'll do my best to answer that, or I can refer you directly to them if I don't know the answer. And if you liked this video, please hit that like button, share it with a friend. And until next time, may God richly bless you and your families and your health, since we're talking about it today. Matt Holt with Christian Wealth Management. See you guys next time.